What is the best way to get them to actually get tested?
Um, that's a great question because you know what? Usually the convincing has been done
Yeah.
by the time they get to my office. So, I think however you're doing it is probably the best way. But if I were the primary care doctor or the OBGYN or the REI trying to convince the man to do it, I would try and just provide the statistics and be like, for a very long time, this was thought to be a female issue alone. But now we know that, you're right, anywhere between 30 to 40% has some contribution from the man. And so to just put all of this anxiety and potentially procedures and potential complications and to put all that on the woman, I would shame the man.
So the only
To say that you're really not doing your part.
So the only way I've really been able to do it, like I mean, some men will happily do it, fine, move on. But the ones
I'm
that
talking about for the ones who are.
the ones that are a little difficult, I end up bringing them in for like a preconception visit, and when we're going through it, and I literally have to sit them because they're like, no, and I'm like, listen. Sometimes I'm like, what did your middle school look like? And I'm like, you've done this, you know what I mean? Like this is, you're like, I'm asking you to leave a sample. Like we took your wife's blood. The next things I have to do for like female infertility workup, we do an ultrasound, look for any anatomical causes. We have to literally put a catheter in their uterus, inject dye to take an x-ray. Like there starts to be more invasive things.
Yes.
And for me, I'm not going to go through all those invasive tests until you know the male part.
Exactly.
And I usually have to explain that and push them to finally get them to just...
I think that's probably the best way to be like, do you really want us doing more invasive things to your wife when we could really just get this from a semen sample and potentially move on? Like that's really the way I would phrase it. It'd be like, just imagine, and I would probably go into detail of all the things you would have to do. I'd be like, just imagine there was something that was easily fixable, easily seeable, that prevented me torturing your wife.
Which is great. And yeah, sometimes we end up torturing them anyways. But because I know, like, you need to know if the tubes are open, this and that. But like just to get them involved. And also like Miami's an interesting place because there's a lot of people on TRT and a lot of steroid use and abuse down here. I'm very pro testosterone as a therapy, but it's interesting to know actually how many people come to my office and they're shocked because either a doctor told them or Instagram told them that higher testosterone equals higher fertility, but we're talking about exogenous testosterone.
Yes. I will say there's something, I think we're doing much better now. There was a study about 20 years ago, which honestly I still find shocking, but again, this is 20 years ago. They did a survey of urologists, not the general public, not general practitioners, urologists, and they were asked if they thought exogenous testosterone would improve male fertility, and 60% of them said yes.
That's nuts.
Just to show you how
this is your field.
Yes.
This is the thing.
Yes. And so thankfully within that time, really andrology and sexual health as a whole have really gotten so much more attention, so much more work, so much more mainstream that even urologists that are not male infertility specialists, that are not sexual medicine specialists, that it's become a lot more of the general knowledge within the public and within urology as an entire field that I would virtually guarantee those numbers are nowhere near what it used to be. But just to say that 20 years ago, the specialists even had a problem with this. So as much as, it's a really sad thing to see. And it's something I see all the time where young men come in and they're having issues, they're forced by their wife to finally come see me. And we start talking about their history, trying to have kids for a year, never had any issues, no medical problems, blah, blah, blah. And then usually a lot of times I see they're like jacked and I'm like, what cycles have you been on?
Yeah.
Or like, what are you doing? Like, this is where you say something. Mm-hmm. And they're like, oh, sure. But like, that's not medication. I thought
you were going to say natty for life, baby.
Of course, but you gotta push past that. No, but it's either like, most of the time, my trainer or my coach or whatever just gave it to me, and now I've been on testosterone for a little while. But even a lot of times they're getting it from testosterone clinics, from different providers, different physicians, and they're not really given that full piece of it, that it affects their fertility. Or, I don't like to be all doom and gloom. Maybe it was just, not really thought about it, or even if it was said, it was not really internalized. When I really think it should be, if you're dealing with someone who may even potentially want to have kids, like that should be at the forefront. Like, do you know that if you take this, you will likely become infertile while you're on it? If you want to become fertile after, even though it's very likely that you will, your testosterone will probably never recover completely to where it was. And you probably will be somewhat symptomatic after that, and then probably desire or need testosterone therapy after that.
It's an interesting thing there, because I always wonder, does it not go back to where it was before because they're older, or because there's a lot of things there? And then the two is, obviously there's two reasons why people go on testosterone. Some's just for their bodybuilding, but some people go on for testosterone replacement. If you're going on for testosterone replacement for low testosterone, then obviously it's not going to be where you want it. But it's an interesting thing there, because men's testosterone tends to drop subtly, but over time. So if you're on testosterone for 5 years, it would make sense to me that 5 years later, on average, it would be lower. Not always, but...
That's an interesting question. I don't think that's really been completely delved out. To what degree you've kind of subdued your system to now it doesn't know its complete baseline, or it's lower, or age. And really age is just a surrogate for different changes that happen in the body that would keep your testosterone lower, whether it be different comorbidities, metabolic syndrome, all of those different things, which we could also get into. But I don't think it's been completely figured out exactly what happens, why. But we do know that the longer that someone is on testosterone, that the longer they'll take to achieve normal hormone levels, and definitely the much longer it'll take them to achieve proper spermatogenesis and fertility, if they're ever going to get there. And to be clear, most people, if they had normal fertility before, if they wait long enough, most will get back to that point.
Yeah, and there's ways, obviously, you can talk about to bridge that, to increase the natural production again.
Yes.
But
so there are different protocols that you can give people Clomid, you can give recombinant FSH and HCG, all things to boost the body's ability to send the signals to the testicle, to produce its own testosterone, and therefore also produce more sperm. But I think it's honestly debated whether that actually helps, or it just feels good that you're intervening to make it happen faster.
Interesting. I thought the FSH would increase it. As I'm thinking too, because when you think about this, right, I'm thinking from the perspective as, okay, there's a guy out there that's taking testosterone, maybe not telling their partner, or maybe just whatever, but they say, I'm going to go cold turkey. And when you do that, I think it's the closest thing a man can do to feel like they're going through menopause, because it is the only time where a man will have a very sudden change in their hormone levels overnight. And my point is yes, it sounds like their fertility will come back slowly, but wouldn't it be a lot better if you can keep your testosterone levels to a decent level and also get everything moving back faster, and you don't feel like crap? Your chance of actually going through it well, feeling good, and also just actually inside going, okay, forget this, let me just inject, because you'll get your levels back faster, better, and not have those nasty side effects.
Absolutely, and there are ways of doing that. It's just typically not going to happen if people are taking testosterone at the gym, because they're not under the guidance of a physician. For instance, there's a subset of people that have Klinefelter syndrome, where they have XXY, and so they have a very small amount of sperm producing cells in their testicle, but a lot of times, not always, but a lot of times they do actually have them there, but they need to be really stimulated. So first of all, they have very low testosterone levels to begin with. So you treat them symptomatically by giving them exogenous testosterone. But if they want to also become fertile, you can also give them HCG at the same time. And so you're raising their testosterone, but then you're also replacing the hormone your body would naturally put in to have that testicle actually produce its testosterone. And sometimes you can add recombinant FSH in there, but typically that's the protocol for Klinefelter. So you can extend that theoretically. There's been no trials, but you can do that in order to, because the whole thing is giving HCG or with Clomid, all of these other ways of raising testosterone, even though they do work, sometimes they don't really get to the level of testosterone that some people are looking for. And so
it's hard to hit a super physiological dose that way.
Exactly. Or even like a high physiologic dose, however you want to call it. So the only real way, and this was one of the trials that we did on my year of research, is with the intranasal testosterone and testo. So it's an intranasal gel. You use it 3 times a day, and we did a trial showing that it raises your testosterone to the physiologic levels. People were happy with the results in terms of how they felt, libido, improvements in concentration, improvements in the gym, everything they were really looking for. And we also tested their sperm, and we actually showed that they preserved spermatogenesis and they preserved fertility. Actually, one of the patients on the trial was able to get his wife pregnant.
That's incredible.
Which was great. The issue with
Unless it wasn't wanted.
It was wanted.
Okay.
Yes.
Just making sure. If he was like, no, I thought the testosterone would stop it. Testosterone
This is
is not
worst.
Testosterone is not birth control, guys. Just to be very clear.
Yes.
Yeah, okay.
And so the only issue some people have with it is, twofold, is that you have to take it 2 to 3 times a day, and also because you're putting a gel in your nose, a lot of people would get sinusitis, which was kind of a limiting factor. And so there are some things coming along that pipeline. People are trying to figure out if there's another way to do that. But for now, that's the only real clinical trial that has shown testosterone administration with preserving fertility.
Yeah, so just to be clear there, for in case it wasn't, because Nutesto, they're taking it 3 times a day, the half-life is so small that it lets your body readjust, versus if you take a long-acting testosterone of some sort, it'll keep everything low for a long period of time and can suppress things, I guess, like birth control. It's just doesn't work that way for everyone.